Hey, good evening, everybody. It's Dr. Christine Anderson here. I'm a Los Angeles-based chiropractor. My specialty is pediatrics and pregnancy, but I see a lot of families, and guess what? I also see a lot of issues with elimination problems like constipation, diarrhea, bloating, gas, etc., right? So we are going to delve into that tonight. This is a very crazy time in our life. If you are catching this live, say hi. Let me know you're here. Everybody is at home. This is going on the second week of the lockdown in the US where everybody is staying home. So they're not going out. And our lives have been a bit disrupted. But thank goodness we've got things like our digital world with YouTube and Facebook Lives and whatnot so that we can kind of keep connected. Think about if we didn't have that, it would be so much harder because we do need to keep that connection. It's super important. And so I'm glad I could still be here and go over this information with you. And if you're listening to this sometime in the future, hopefully all of this is behind us, that we are no longer in quarantine and you are able to go back to some semblance of your normal life, whatever that's going to look like when this is over. So we're going to do what we can, which is what's in our control, right? And our lifestyle choices are certainly in our control. We can't control what's going on out in the world, but what we are doing with our gut, our digestive system, and certainly our elimination system is certainly within our control. Okay, so what is optimal elimination, right? How often are you supposed to have a bowel movement? And what is that supposed to look like, and all this type of stuff, because it's going to be very subjective. And I hear this a lot. In other words, I'll have a baby come in and they might not have gone and had a bowel movement for like 4 days. And a medical pediatrician might say that that's normal. But in my world, that is not normal, because the average transit time should be between 33 and 47 hours. So even though that's the case in most people, in babies, it's typically faster because they're eating a lot more often. And let's face it, guys, I don't know about you, but if I don't go to the bathroom every day, I'm not going to feel my best, right? It doesn't feel very good. And so we want to talk about this aspect of elimination, which is the time it takes for food to digest. And it can vary from person to person. But in general, it's between 6 to 8 hours from the time you eat the food until it reaches your small intestine. And then, of course, from there, it travels through the small intestine to the large intestine for elimination. So the number of stools that you have is going to be closely linked to the type of foods you're eating, the amount of exercise you're getting, your hydration status, and we're going to talk about all of that. So while many people, I think, in my opinion, and again, this is my opinion, but it's an educated opinion, you should be having at least one bowel movement a day. If you're eating, you should be moving food through. It shouldn't be sitting there, because the longer it sits there, it's going to putrefy, it's going to gather more toxins, and it's not going to be a good situation. So let's just dive right into constipation, right? What is the definition of constipation? It's defined as infrequent or difficult elimination of the feces. Great. So infrequent, what does that mean again? So this could be, for me, it's at least once a day. Maybe some people can go every other day. To me, any longer than that is not going to be optimal. It might be quote unquote normal, but it's not optimal for your body. Should be at least once a day, maybe even twice a day. It does depend on the volume that you're eating. So, or the amount of fiber too that you're eating. The more that you're having fiber, the more it might transit through. So it is also going to be that consistency of your stools, right? So you may be having a bowel movement, but is it hard? Is it too soft? We want something that is going to be a coherent, solid stool, but not too hard. And definitely, we don't want it loose or mucousy or anything like that. I know this is just what you want to talk about today, but you know what? Everybody poops. There's a book about it for kids. Everybody poops. We got to do it. Nobody likes to talk about it, but it is super important and it is part of our system that needs support a lot of the times. If you are having constipation, that's a symptom. It's not actually a disease. So if you're treating constipation, you are actually not it's part of the issue of what's going on. It's just your body telling you that there's some things that you need to take care of. It's not a disease in and of itself. So you want to make sure that you're not just blowing it off like, oh, I'm just constipated. You want to make sure that it's not more of a serious problem. And believe it or not, it has led to more than 6 million doctors' visits and 700,000 emergency room visits and costs billions of dollars in direct and indirect health care costs. So it is a really big problem, right? The things that are going to put you more at risk for constipation are things like eating a low fiber diet. There are medications that can affect your bowels, dehydration, lack of exercise, if you're using laxatives or enemas. So we're going to talk more about that. You can also help support your system while you're trying to have a bowel movement. Don't hold it. Go when you feel like it. We're going to talk a little bit more, and I'm going to give you some tips on how to prevent constipation. But 15% of the US population is suffering from chronic constipation, meaning they have it for long term. And so that means 63 million people are having difficulty. They're passing dry, hard, lumpy stools. They're feeling bloated. They have abdominal pain. They might feel like something is stuck in their intestines or their rectum. No fun. And some reports say up to 25% of all pediatric gastroenterologist visits are for constipation. That's a lot. That's a lot. 25% for kids and 33% for over age 60. So what are some of the long-term effects of chronic constipation? I've said it's not really good, but it can actually increase your risk of colon cancer, Parkinson's disease, kidney disease, hemorrhoids, stool incontinence, that's where you can't control whether you go or not, anal fissures, urologic disorders, rectal prolapse. So this is not a joking matter, right? You do not want to have these type of things. So how does this relate to chiropractic? I'm going to talk about some of the things that you can take care of. But in my world, I see people who actually come in and constipation is a symptom they are having, right? So there's a whole aspect to this. We know that the brain controls what goes on in the body, and the nerves that are going out to our digestive system, our stomach, our intestines, our large intestine, our rectum, everything needs nerve supply so that those nerves are connected to the muscles in our system that can help move things through so that it's not getting stuck. So when the spine is misaligned, then things may not be moving through the digestive system as they should. And this is especially in certain areas of the spine, sometimes the lower part of the mid-back or the low back, and for sure, another part of the spine called the sacrum. And that's the part that is connected. That's the bottom part of our spine. It's the foundation, and it's connected to our pelvis. So this is what I do when people come in with constipation. Sure, I'm going to go over lifestyle issues because they have to take care of those things themselves, but I'm going to check and make sure that there's no subluxations that might be affecting the nerves that go out to those things that help with elimination, right? So that is, that's it kind of in a nutshell. And there are definitely some studies that have been out there. There's one that was put in the Journal of the Canadian Chiropractic Association, September 2001, the effects of chiropractic care on a patient with chronic constipation. That's just one paper that I found, but there are multiple things out there. So some of those causes of constipation we touched on: your diet, sedentary lifestyle, stress and anxiety. That's a big one because that affects, again, our nervous system. And it is going to kind of shut down our parasympathetic system, which I've talked about. If you go back to the program I did on stress management, I talked about the parasympathetic system, which is our rest and relaxation and rejuvenation. And we need that parasympathetic to kick in, to relax, to be able to go. Because if we're all uptight and clenching everything, it's not going to happen. So let's talk a little bit about overuse of laxatives and enemas. So the active ingredient in many enemas draws water from your body into the large intestine. So that helps soften the stool, and that's why it works for constipation. But when you use them too much, it can actually put you at risk for dehydration because you're pulling water from your body. You can alter your electrolyte balance, and you can actually then have a high risk of kidney or heart damage and even die if you really mess around with that electrolyte balance too much. So you don't want to really mess around with that. And laxatives are actually stimulants. So what they're going to do is they're going to increase that muscular action in the intestines to kind of push things through. Other times people will use things like caffeine, which is a stimulant. If you're relying on anything like that, even if it's natural, even things like senna or cassia, which are laxatives, you use them occasionally, okay, but you don't want to rely on these because they can actually damage that connection between the nervous system and your intestinal system. And basically, your brain will shut down and won't work anymore and tell it to work because it gets lazy. It's like, well, why should I do it? You're taking the laxatives to do it. So you definitely don't want to do that. Now, there are also some medications that can cause constipation. So if you're using opiates, antidepressants, antacids, and antihypertensives, those may also contribute to constipation. So you have to take that into account. There's also a balance. I talked a little bit about electrolytes. There's magnesium, which is a mineral. And if you want to, in the short term, try to help your body sort of relax, the muscular action, the nervous system, magnesium can be super helpful. So just on the short term, though, you don't want to use it all the time because, like anything else, you don't want to create an imbalance of what's going on. So magnesium is essential. It's used in so many cofactors of processes that are going on in our body. You can either use something like magnesium citrate, but you have to be very careful because it does create loose bowel. So you don't want to use too much. You want to start very low and then just try a little bit and see what happens. For younger kids, for babies or younger children, I even sometimes have the parents put the magnesium in the bath so it can get absorbed into their skin, which then gets absorbed into their bloodstream, and kind of do it that way. It's a little bit gentler. But you can certainly try that. There's different forms of magnesium that help different things, but in this case, the citrate form of magnesium does tend to have a laxative action. Action, that's what I want to say. So be careful. You don't want to do too much. While we're talking about vitamins, you want to be careful. Well, this is a mineral again, but you want to be careful with too much iron as well. So if you're taking an iron supplement, or you're using a lot of your cast iron skillet, or you're having foods high in iron, it doesn't usually happen so much with that because it's a different form, but maybe you're having a lot of meat and not a lot of fiber. That's going to be something that you want to take into consideration. So here are my tips to help with constipation. First of all, view my 7 facets of optimal health YouTube video, because you have to go back to the basics. Number 1, you want to eat fiber-rich foods. That means you're replacing refined products with whole, unprocessed fruits and vegetables that contain fiber in them, not the juice, the actual vegetables and the fruits. The American Heart Association recommends eating 30 grams of fiber each day. That's conservative. That's a minimum. So at least that. You've got to have adequate water. If you take fiber in and you do not also consume water, then it's going to bulk up and it's going to get stuck. So you definitely want to drink enough water, at least half your body weight in ounces. That's the minimum. You want to exercise. The movement of your body helps completely with the movement of your bowels. So you're going to have everything moving much better. Exercise has such a great effect on your brain and nervous system, and that's going to help that functioning well, great as well. I talked about chiropractic, enough said, but it is funny because babies will come in, I'll adjust them, they'll pretty much poop on the table. They've got a diaper on, whatever. And sometimes, if that's their issue, their moms and dads will bring them in, and before I even work on them, it's like they get in my office, it's like a Pavlovian response, and they just poo before I even work on them. It's really funny. It's great. Reduce stress and relax. I know it's tough right now. We're going through a super tough time right now, but you've got to take care of yourself. That self-care is so important. This is the stuff that you have control over, right? Pre and probiotic rich foods. I went over this in super big detail last week talking about the microbiome, and that includes cutting out sugar because that's going to affect your microbiome. So go back and watch that. Now, our whole system relies on a toilet, but that is often very hard on our elimination system. It can pinch off the exit for the waste, right? It makes it more difficult to have a bowel movement, especially if you are constipated. So if you squat, then that's going to bring your body in an optimal position. And there's a bunch of different things out there. There's squatty potty and different stools or whatnot. And in a pinch, you can even stand on the seat. Just saying, right? If you're having an issue so that you're not straining too much, squatting is the way to go. It's going to maximize the efficiency of your evacuation without straining. All right, now we're going to go in the opposite direction. Just take a few moments for diarrhea. Great, another great topic, right? So this is when you get diarrhea when your body's releasing more water than normal with your stool, flushing the food and fluids rapidly through your digestive tract. I think we've all experienced it. Usually it's termed diarrhea when you're having at least 2 to 3 times a bowel movement in a 24-hour period. So that's what we're considering the definition of true diarrhea. So your digestive system is sensitive to dietary changes. It's going to depend on the health of your microbiome and your overall health. And all of that is going to contribute to how your stool is formed. So research has discovered the process of diarrhea may actually help your body to flush out disease-causing bacteria from your intestinal tract. Go figure. Our bodies are so smart, right? Something's in there, it's irritating it. It wants it out. Like, get it out. So you don't really necessarily want to stop the process, especially if it's acute and self-limiting. So it might lengthen your illness if you try to stop it. So let it do its thing. It's only if it's continuing that you really have to, worry about it. So while deaths from diarrhea illnesses have decreased in lower income countries, guess what? They've increased in wealthier countries. And this is due to the overuse of things like antibiotics, increasing consumption of sugar, which is upsetting our microbiome, using antibacterial wipes and that type of thing, which is going on right now. I mean, it's crazy how people are trying to sanitize their world. And that's not what we should be working on. We should be working on our internal bodies, because when we have strong and resilient and healthy bodies, they are going to be able to adapt and withstand whatever comes along, no matter the name of the virus, bacteria, parasite, etc. Sure, we may have symptoms, But that's the clue for us. That's our warning light to go, wait, something's going on here. Let me look at it. Let me address it. Let me help support my body. So there's types of functional diarrhea, including irritable bowel syndrome or inflammatory bowel disease. I'm not going to delve into those. I'm going to talk more a little bit about some more common issues. These are definitely disease processes that have diarrhea as a component. Other causes can be drugs, endocrine disease, cancer, malabsorptive disease, things like celiac disease, which is actually an autoimmune issue. Again, I'm not going to delve into these, but just knowing that if you have a chronic diarrhea situation and you're trying things to help support your body and it's not changing, that you might want to look at these things. So there's 3 types of diarrhea defined by how long it persists. You've got acute, which is self-limiting. It's lasting a short time. That might be due to things like food poisoning, bacteria, viruses, an allergic reaction or a sensitivity. You're trying to flush it out super quick and then it's done. Then there's persistent. Maybe it's continuing for more than 2 weeks, but not more than a month. That could be due to some of the acute self-limiting things that have kind of persisted because you keep irritating your gut, or it may be transitioning to a chronic issue, which is usually longer than 28 days. And these might include things like dysbiosis of your gut, disruption of your microbiome, parasitic infection, chronic bacterial infections, chronic food sensitivities, and kind of altogether this sort of leaky gut issue, because then that's going to make everything worse. It's going to make you more susceptible to all the things that we're talking about. And again, for more information on that, go back to the microbiome lecture. So what the research demonstrates is that any medications you take to stem the flow of acute diarrhea can actually do more harm than good. So if it's one of the things that it's occurring and it's going away in a couple of days, leave it alone. Just let it do its thing, right? As a caveat, some of the things that you have to look for is dehydration. So you want to make sure that you're replacing fluids and electrolytes. And that can look like adding a little Himalayan salt to the water, or doing things like smart water or recharge or coconut water. I don't recommend the super sugary replacements like Pedialyte. So much sugar, and they put dyes in there. So there's such natural ways of doing it. And you'll see those electrolyte drops that you can put into water. And there are some that are better than others. I use a brand that doesn't contain artificial sweeteners, so you don't want to do that. So just be aware of that. You don't want to use anything that you're replacing electrolytes with that's sweetened artificially with sucralose or aspartame or something like that. Also at higher risk are pregnant women and the elderly. So you really just want to moderate and make sure that they're getting their fluids in. If they're not, and you fear that there's dehydration, that's when you need to go to the emergency room and make sure that they get hydrated. That is the biggest concern with diarrhea. That's the thing that is the high mortality, not the diarrhea itself. Okay, that is it for wrapping up with the optimal elimination. I hope that everything is moving smoothly for you. Ha ha ha. If not, of course, if you're in LA, come talk to me. If you're not, find a chiropractor in your area, because that can be something they can help you out with. And if you like what I have to say, please give me a thumbs up. Share this with your friends and family, and please subscribe if you want to know when I am posting a video. All right, everyone, you have a great night, and I'll see you next week on Tuesday. I will be wrapping up this month that we're focusing on the gut with optimal detoxification. Have a great Tuesday evening. Good night.